Hello, everyone. I'm happy to be back with another Young Indian, part of the Voice of the Young series. Right now, we have with us Namita Mittal. Let's listen to her. Over to you, Namita.
Thank you so much. Thank you so much for having me here, giving me this opportunity. I feel it is very important for all of us to understand and listen to those who are in the same field trying to do similar things and just understand their perspective. And hence, I feel this is a very important opportunity for me to share my views. And I try to be as natural, organic, and honest about whatever I share. So I'll start with a very brief introduction about myself. I come from Dehradun. I completed my bachelor's in sciences from University of Delhi St. Stephen's College. I majored in computer sciences and mathematics. But during college, through various experiences, I realized that maybe I'd like to work in the governance impact space more, where I can work with the masses, for the masses, and maybe create that impact. Maybe I'm not sure of the intensity or I'm not sure how valuable that impact would be, but I wanted to work in that space. And hence, I prepared for civil services for a couple of years. But after that path, I had to get away from that path. That didn't work out as well for me. I joined an edtech organization known as Educational Initiatives. I was working on assessments, curriculum, and pedagogy. It was a really wholesome experience. I worked on trainings. I worked with central boards on their assessments and reports. I really gathered major experiences there. But then I wish to work more closely with the government. And hence, right now, I'm pleased with a fellowship of the University of Chicago Trust, known as International Innovation Corps. I am working with the government of Uttar Pradesh on a digital health capacity building policy. Uh, yeah, that's a very brief background about me. I can share more about certain experiences about my transition, what happened in between, and everything.
Yeah, please do.
Sure, sure. So I really start with what happened during college, why I chose to start preparing for civil services and then worked in the social impact space. So I'll be honest, I wasn't one of those who had all figured out. I didn't know what to do and where to go after my graduation. There were multiple pathways. One of the most I'd take that leverage to say common because it seemed very common then to go and do an MBA maybe. I didn't want to jump right that into that. I wanted to figure out if that is really for me. And hence I tried multiple things. I prepared for an exam known as actuarial sciences. I did that for a while, but I realized that this is not where I wish to go further. Then I realized that maybe working closely in those spaces would help me understand where I wish to go further. So I did a couple of internships. One was in the corporate setup, one was with Pratham, which is an NGO. And those experiences made me actually realize where is my calling. Through those internship experiences, through volunteering with clubs and societies at my own college, I decided to pursue civil services because civil services, I mean, it's not an easy path, and hence all of us have those apprehensions. We just don't want to jump right into it. Hence, I took my time, but then I decided to prepare for civil services for a couple of years. Civil services is itself and it is itself a journey. I came back home. I decided to not be in Delhi, take those coachings, because I had my own thought process behind that. I just felt that maybe I give it a shot by myself. There is so much material available on the internet as well. I give a shot to the examination by myself first, and then see wherever I needed help and everything like that. Um, yeah, but I always had one thing in mind. I limited my number of attempts in my head. I didn't want to be in that loop for forever. So I had I had told myself that maybe after a couple of attempts, if it didn't work out, I had to remember the larger goal that I set myself for. And hence, after a couple of attempts, although it was not easy, we forever feel that maybe one more attempt, one more try is my attempt. But I decided to move away from the journey for that time. I thought I'll do that for a while and maybe I can come back. But now I see myself maybe not going back. I am again using maybe, but I'm certain that I'm not going back. But I'll share more about my civil services journey as well. So I really believe that it is a journey full of learning. You grow intellectually. You get that discipline element in yourself. You become very uh, perseverant. You know what you're. I mean, there are times when you have to keep yourself aloof. You have to keep yourself away from so many things. It could be your friends. It could be you limit your social life as well. That is very difficult.
Hmm.
It imparts you certain skills as well. As I said, that discipline angle, punctuality comes into picture. I think the journey also makes you very humble because you read so closely about societal issues, societal problems. So of course you become, I think most of us become more humble as well. I'll say it is a very enriching journey. But being a part of that journey for 2.5 years, I would also like to share the cons of it, the darker sides of it.
Hmm.
So I was at my home for 2.5 years, again away from I because the social life gets limited. I'd say you also limit yourself to your space. You are not very sure about what's
Hmm.
happening, or
Hmm.
what maybe what your friends are pursuing, doing, what are the other options, and everything like that. So I'd say those skills maybe which are required in any kind of job, whether you're working in the public sector or the private sector, you start somehow losing out on that, and that hits you when you're again in the market. I'm using the word market, but again, when you're searching for jobs, when you're looking for jobs that are suitable for you, you feel that there's something missing, and maybe you're a little behind. So that becomes a battle that you have to fight, and that battle continues for a certain period wherein you have to prove yourself amongst your peers, amongst your colleagues as well, because you're slightly behind time when it comes to that. It's not bad because again I'd say that the journey is enriching and you've grown very uh, all of us grow very intellectually, but again there are limitations as well. You have to fight hard to get your job, to gain those skills again. There'll always be a break on your resume, your CV. You'll have to justify it all the time, mostly. So those are the limitations as well. And my key learnings from that journey, if I had to share it with any young aspirant who's starting their journey, would be firstly, uh, it should not be the getting into the services should not be the end goal. I think this is a very cliched line which is being said, but I'll again say that the goal is larger. We should limit our number of attempts. We should realize that those are the most mm, those are the years where we are shaping ourselves, and if we are just into the journey and we are not realizing the larger goal, we somehow start missing out on so much more. So one is that. And second, we should also realize that having a plan B is not so bad. So maybe thinking about other state examinations, other banking examinations, or just maybe coming back and working for a while, doing masters, those options should be very thoroughly considered. So these are my two key takeaways from the journey. I can go on, but if you have something, please come in and then I can.
I think it's enough. We can continue on to something else.
Sure, sure, sure. Sure. So, after I worked in the education space for a while, and now also I'm working in the digital health capacity building space.
Could you
I've
explain what is
learned,
education space?
yes, yes, I'll do that. Um, So when I say I was working in the education space, there are multiple themes within education as well. One is assessments, one is trainings, whether it is for the teachers or whether it is for the administration. Then another very evolving theme in the space is digitization and AI. Then there are people who are working on curriculum. Then there are people who are working in the pedagogy space. So when I say education, I was working on the problems in the education space. And the problem that I was dealing with was assessments. I'll define the problem very briefly. So the today when we see assessments, our assessments are very mechanical in nature. They test mechanical learning. They'll ask me when did this war happen instead of asking why did this war happen. And there is a gap in the sense that when my assessments ask me very mechanical questions, the teaching in the classrooms also happen very mechanically, because somehow the end goal of teaching in our classrooms is maybe to score marks. So if we could reverse engineer the whole process and say that we redefine assessments, make those assessments based on understanding, so classroom teaching also happens that means. And hence I was with my organization working to solve for this problem. Uh, and
How did you get this job? You had no experience in this field. So how did you persuade them?
yes, yeah, yeah. I'll tell about that.
Yeah.
So after I decided to maybe step back into the to work for a while. I looked out for relevant opportunities through LinkedIn, through friends, through networks. I realized that at that point of time, my biggest strength is my subject matter expertise, because for like 2.5 years, I've dealt so deeply into social sciences subjects. And that's what the organization was looking for. They were looking for subject matter expertise, which I could offer. And hence this worked out. Uh, about assessments and everything I learned within the organization. But yes, my core strength at that point of time, which landed me the job, was subject matter expertise. Um, yeah, I could. Should I detail more about how that worked out?
No, this is good.
Okay. I'll tell about the next opportunity that I'm presently in.
Yeah, good. Go ahead, please.
Yes. So right now I'm working with the University of Chicago Trust Fellowship, India Fellowship. The agenda of the fellowship is to place young professionals who are very interested to work in the policy space with the government or critical government stakeholders or NGOs, so that all of us can learn about how policy works at an institutional level. And I really wanted to do that because I wanted to understand how state actually works, how policy design actually works, how implementation works. So I applied for the fellowship. I had some relevant experience in training, and the project was looking for someone who had experience in capacity building and training. And I think the stars aligned. I landed that job. I landed in UP. I'm right now working with on a capacity building project with the frontline healthcare workers. I share my learnings because I think this opportunity might interest many others who are in
Yeah.
the field. My objective was to learn about government, learn more about stakeholder management, learn closely about policy. And honestly, I've gotten through the fellowship, I got a chance to work on all aspects of policy, whether it is designing the policy, implementing the policy, and also looking at the policy from an evaluation perspective as well. I dealt with stakeholders from the state. There were challenges as well, but I got that opportunity to deal with stakeholders from the state as well. I worked closely on the field, so I worked closely with the masses whom the policy is aiming to benefit. So these are some key, I would say, highlights from the role that I'm presently in. So this is from the current role. I can share more about what I'm planning next to do.
Well, tell us what is digital health first. What is
Sure.
digital health?
Sure, right. So, uh, honestly, when I joined in and when I speak to people around, this is the first question that they have as well. So, in very simple terms, when we connect ICT with health systems, and health systems could include people who are working in health, the health infrastructure which is prevalent in the state, whether it be hospitals, and in the government we have primary healthcare centers, community healthcare centers, uh, and the simple logistical infra as well. I mean, how medicines come to the state and then how state disperses those medicines to the facilities. All of it is health. When we connect all this health angle to the ICT, by which I mean, let's say if we have an application which tells the state that at this facility, at this point of time, this facility does not have enough number of medications and we have to send those medications to this facility,
Mm.
this would be digital health. This application which is making all this happen is digital health. And let's say CDSS, which is decision support system, clinical decision support system. When we have simpler systems which through analysis and predictions help clinicians take decisions around around, let's say, surgeries or just follow-ups or just prescriptions, that is digital health as well. And learning through digital mediums, having those trainings through digital mediums is also digital health. So
Yeah.
anything which connects technology around health is digital health.
So it's not really connecting to the patient, it's digitizing the background, whether it's information to the provider, the doctor, or the nurse, or it's a supply chain issue. That how do we optimize and make sure that everybody has the required medicines and stocks and so on. I had a long talk with a person from Bangalore who put together and is, how to ensure oxygen supplies across hospitals throughout India. So I found it very interesting and fascinating, but it's a supply chain issue, really. And then there is an information aspect. It doesn't involve the patient in any
No,
way.
it does.
How?
Uh, no. So this all this digital health started when the government started working on Ayushman Bharat Digital Mission, which aims to digitize the healthcare systems for the benefit of providers and patients both. When I say it should benefit the patient, it is in the way that patients can, the services become more affordable for the patients. They can get those services sitting at home, maybe. They do not have to visit and go to the facilities. The systems become more transparent. In policy making would also become more efficient when we have all this data combined and not fragmented, and hence the end, I would say the end beneficiary remains the patient. We are yet to reach there, of course, because the patient is the last mile beneficiary. There'll be a lot of awareness, capacity building required for them to avail those benefits. But again, the patients are supposed to be the end beneficiaries.
Yeah, no, I understand that. I'm just saying that it does, you are indirectly making that happen. You are not directly involving the patient at this stage. You are
Yeah,
giving the
at this stage,
benefit,
no.
you are giving the supply chain benefits to the patient, making sure that what the patient needs is available, and you're making sure that the decision makers have information that they need to make decisions. But it's not telehealth. It's not where the patient says, listen, I'm talking on a remote channel to a doctor. It could be that also, but there are other parts to it. Fine. I agree. I understand. Okay. Go ahead, please. Tell us about something more that you are find interesting or you feel like talking about.
Sure. So, I mean, apart from, I'll tell about what I'm planning next, or
Yeah.
what after this.
Yeah.
So, honestly, I'm at crossroads. Think I've had no formal training or education in the public policy development space domain. I graduated in sciences and then I stepped foot in I started working. Presently I'm thinking through what could I do next. Should I still be working? Should I take some more time to understand the field? And that, and I'm doing that so that I don't make any hasty decision wherever and whatever I go and study. Uh, I can come back and see that it translated to my work. So presently, I'd say I'm I'm rethinking what should be the next steps, but mostly uh, from a very peripheral view, I'd still be wanting to work in the sector. And even if I plan my master's, it will be related to uh, I am thinking of maybe being in the space and hence attaining an education which will help me in the space. So this
Okay.
is what I've planned. I'll not say planned because there's no plan, but this is what I can think through for now. Uh, and apart from this, in my free time, I like watching movies. I'm fond of traveling. I'm interested in food, not as much cooking, but eating good food. Uh, yeah, I think those are my interest areas. I'm trying to do new things. I've not been an avid reader, but I've started reading. My last reads were Khalid Hosseini's A Thousand Splendid Suns and The Kite Runner, and these were very amazing, very heartwarming reads.
Hmm.
I'd recommend that to anyone who's not a reader and who just starts wanting who's wanting to read. So I'd recommend these books to those people. And
Okay.
yeah.
Well, anything else you have on your mind?
Uh, I just like, I mean, I just like to say that it might sound very preachy, but sometimes to connect the dots, what all of us do is, let's say I started preparing for the civil services, and then very intuitively it made sense to set foot in the social impact development space, and which I did, of course. But I'd just like to share that changing paths at any point of time, although it requires so much strength, so much I'd say contemplation as well, but that we should not be worried about that. Connecting dots should not be, I'd say, the final aim. Whatever at that point of time you feel you're interested in doing, which drives you, I think that should be I think we all should work around that instead.
Okay.
Um,
All right.
yeah.
Thank you so much for such a honest and clear, as you said, you would be honest and clear. Well, you were honest and clear. Uh, talk to us, telling us about how you've changed your path. And still, there are some obstacles and changes to be made. And I guess that's part of being young. And so be it. Okay. So enjoy it. And hopefully, your work will make a real difference in the digital health space. It's an interesting idea. And let's see how it works. Okay, let's say bye now. I'll be back with another young person or an expert soon. Till then, bye everybody.